Thanks for joining us today. I am Jess Carson. I'm a research assistant professor at the Carsey School of Public Policy. Welcome to the Carsey Roundup. We're doing an update on the state-by-state jobs data, and with me today are the director of the Carsey School, Michael Ettlinger, and our fabulous policy analyst, Jordan Hensley, here to talk about their work on the state-by-state jobs data. Michael and Jordan, thanks for taking the time. Good to see you guys.
Nice to be here.
Great.
Wherever here is these days.
Here is everywhere. So this work, you guys have been doing a lot of great kind of tracking efforts. And before we dive into the specifics of the most recent data for folks who have maybe not been following this project as closely, I wondered if you might give a brief overview of kind of the biggest trends in job losses that you've seen as you've been tracking this set of data.
I mean, there have been a lot of them, and they're everywhere, is sort of the short version of the story. We did see a little bit of a rebound in May, from April to May, which is when the latest comprehensive data are available for. But, that was coming back like nationally, 2.5 million jobs, still leaving us 20 million in the hole from where we were in February. So overall, it's not a pretty picture.
Yeah. So thanks for that. That helps to kind of orient folks where we are. Jordan, I wonder if you can maybe say a little bit about what is new in this most recent batch of data.
Yeah, I mean, we're seeing some amount of jobs rebounding. I think nationally at least, in every sector except for government, jobs have come back. But as you can see when you look through our data, there's kind of a wide variety of trends going on at the state by state level, and in different states, different sectors are disparately impacted, including still disproportionately lower wage industries.
One thing I'll just add to that is what we're really seeing is a bunch of people getting back to work, but a whole lot of new folks getting laid off is what we're seeing. So when we're talking about jobs coming back, that's a net effect of a slight uptick in almost every industry in almost every state, but it's just a slight uptick overall, but it's a mixture of these two things that are going on. People being reemployed, and then businesses sort of like were able to put off layoffs for a while, facing the reckoning that was coming.
Yeah, that's a good clarification. If you look at the initial unemployment numbers, they're still remarkably high, even as they've dipped somewhat from the peak that they had been at.
I think that's a really important illustration too, in that when we're talking about any jobs starting to tick upward a little bit, that we're not necessarily thinking about, folks who lost a job and they're just waiting for restrictions to be lifted or businesses to reopen, and then their same job is there waiting for them, right? That sort of ties in, I think, to one of the most striking findings, which seems to have been persistent over the last few iterations of this, which is, as Jordan just alluded to, the kind of clustering of job losses in these lowest paid industries. And that seems pretty persistent across states. Is that indeed the case, that is the patterning in every single state?
Yeah, it's, some of that is driven by the biggest example of that is, of course, the hospitality industry and travel related industries, which are often low paying, people who clean hotels, waiters, waitresses, that whole industry. But it isn't confined to that. Retail in general has been very hard hit, but also like temporary workers have been hugely hit. There've been also been big job losses in the health industry, actually. And that, of course, ranges from highly paid doctors to orderlies and people who are less well paid, but that's been hard hit, and particularly the low income side of that has been hard hit.
Particularly for those lower paid industries, I'm sure it's hard to say given that this context is quite different from previous recessions or, other instances in which we might draw on. But I'm wondering if you have any sense, perhaps from the initial data that you're tracking here, what these industry specific recoveries are going to look like, what that patterning looks like. Is it as simple as, restrictions are lifted in certain states and those hospitality or tourism related jobs just sort of bloom again, or is it more complicated than that?
There are a couple of points. One thing I should say, we're focusing on the fact that job losses have been heavy in low wage industries. The flip side is also that job losses have been much less in higher paid industries. So like the information sector, professional services, lots of these kinds of higher paid industries have seen relatively few job losses. So that's the flip side of that coin. In terms of whether they come back, one thing that's worth pointing out is that the government intervention of shutdowns obviously affects things, but the decline in employment predates the actual formal shutdowns. And what we're seeing is the biggest job losses are in states that have the most COVID-19 cases, which are not necessarily the states that have had the most drastic shutdowns. So it's the disease, not the response, that appears to be the biggest, cause of job loss. So just because we start having formal openings of business doesn't mean that the jobs come back. And particularly in the travel and hospitality industries, obviously the official barriers to them opening matters. But people, first of all, they're opening at reduced capacity. People are just going to be reluctant to go out to dinner if there's still this disease amongst us and this threat of getting sick and passing it on to your loved ones. So it's honestly, it's very hard to predict. But you think that particularly the travel, accommodations, hospitality industries are going to have, it's going to be until there's, until we really address the health problem, there's going to be big problems in those industries. And those, of course, have carryover effects, right? Restaurants have accountants and lawyers and, the commercial real estate industry. And, so it just sort of, and waiters and waitresses spend money, which, ultimately ends up in the pockets of manufacturers, and you don't build it, so it all is interconnected. So, sadly, it's likely to be a slow slog back even when formal restrictions are eased.
You made a couple of interesting points that I want to follow up on. One is sort of, you're right that these higher paid industries seem to have been buffered a little bit from the losses that we've seen in the lower paid industries. I wonder if you have a sense, is that because those jobs are more, quote unquote, essential or beholden to continuously operating, or is it because they're more portable and folks were just able to continue while working at home, or a combination of both?
Yeah, I don't know if Jordan has any thoughts on this. Some of it, just a lot of those jobs are, so-called white-collar jobs, which you can do from home, right? We're doing our jobs, from home because we don't have to be physically at some place to do it. And that's disproportionately, if you're a computer programmer or an executive or, there's just so many jobs that you can do remotely. And they tend to be higher paying, right? I think that's just a big, that's got to be a big part of it, right? I don't know if you had any other thoughts, Jordan, on that.
Yeah, just that some sectors involve a lot more human contact than others, even within face-to-face industries. Being in travel and getting people on a plane or confined in a small space in a restaurant is different than operating even a grocery store. Although we have seen job losses in retail, but so there's just a lot of different layers to that as well, and so it's hard to tease apart, especially from some of these bigger data sets, what exactly is driving the micro parts of the macro industries.
I mean, even within industries, so finance and insurance is a relatively high-paid industry, and it has not been seen, all that significant job loss relative to other industries. I think 8 states are back to where they were in employment in that industry. But that the people who have been furloughed at least are the tellers, not the executives or the loan officers or the higher-paying positions. So it's just that's sort of I hadn't really thought about it before this all happened, but it definitely is the case when you think about it, that those are kinds of jobs that the personal contact jobs are much more lower paying.
So I find it really interesting that you mentioned the kind of correlations with the COVID caseloads versus the kind of stay-at-home orders per se, that the infections seem to be more tightly linked with the job losses in some of these regions. Another factor that seems like it would maybe affect overall job loss in a given state is the industrial mix of the state. And I wondered if you had any thoughts to add on that, or if there were other factors that were state specific that we should be thinking about when we're trying to understand these data and what trajectories individual states might take in recovery.
Yeah, I have not really, I've looked for that. And I will say that, if you look at the worst hit states, there's pretty much one of two things is true about it, or both. It's been hit hard by COVID-19 cases, or it relies heavily on tourism, right? So Hawaii's really hard hit, Nevada. And Hawaii has not been particularly hard hit by the disease, obviously really hard hit by tourism. Vermont, Nevada, those states it's much more the travel industry than the COVID incidents that's done it. So that's been the one thing you've seen. But other than that, it has to be pretty dramatic, like Nevada or Hawaii, that's really dependent on those industries for it to show up. Because every state has, tourism. Little differences don't seem to make much of a difference in these data. Every state has restaurants and bars. And so and every state, those have been the hardest hit industries. There have been variations for reasons that I don't pretend to understand, and how hard some industries have been hit in different places. So the thing that stands out was that Michigan has been very hard hit by job losses, and they're like 11th in COVID cases per capita as of mid-May when these data are from. But their manufacturing industry was hit much harder than manufacturing industries in other states. And, Michigan, we think of it as auto industry, but it's not hugely more dependent on manufacturing in general than some other industrial, manufacturing states. But its manufacturing has been harder hit than manufacturing in other states. So you see, there are those sorts of things you see.
That's interesting. You mentioned, I think, at the top of this talk that we've seen some very small job gains in this most recent batch of data. Is it correct that nobody has matched their February levels of jobs, and that nobody yet is close in terms of individual states kind of leveling out on their job loss?
Yeah, no one's close.
Yeah.
It's like you can pick 5, as I said, 8 states in one industry are back where they were, but no state is even close. I mean, we're down, nationally we're down 20 million jobs, and it's just, no state is close. And it's a big open question about what this recovery is going to be like, and it's hugely dependent on the disease path. It's, people are looking for economic solutions, and we really need a health solution before any economic, any of the traditional paths to solving economic downturns are going to work.
Yeah, I think that's a great point. I mean, you can only incentivize economic behavior to a certain point, and at some point people are, they're going to value their health and have to weigh that against that, and until there are better options, it's going to be difficult, I think. I mean, we're seeing in the data that, for many people to come back.
That's a good point, and I think probably contributes to how complicated it is to try to project this, which I'm not going to ask you to do, to project, next month's job gains or something. I expect neither of you are wizards or magicians, but I think folks are, eager for answers, and that health component of it certainly complicates the ability to kind of use prior work to project forward. I know that this work draws on a couple of different data sources, and they're really important components of the way that we kind of think about the economy and measure it. But I wondered if you could say anything about who might not be captured in the job loss data and the unemployment rate data, and what implications that has for understanding the real economic impacts of the pandemic and related labor market changes.
The main number we've been focusing on is a payroll employment number, which doesn't count the self-employed and gig workers and work of that nature. The unemployment rate does include those people, and it's spiked upwards dramatically. It has its own issues, it's sort of technical, but the way the questions are asked when they ask people whether they're employed or not are not terribly well suited for right now, because it's asking whether they're looking for work or not. And there are other questions that try to get around that, but it's just such a weird time because there are people who are not working. It's a little ambiguous whether they're going to be asked to come back. It's a little ambiguous whether they're looking for work, because lots of people just aren't, because there's nothing to look for, and they're not comfortable going back. So the unemployment rate number, it's dramatically up, but it's a little unclear, what it means. So we're certainly, when we say there's 20 million payroll jobs down, we're certainly missing huge swaths of people, and that number is definitely an understatement of the number of people who had been working who were working. It's just they weren't formally on a payroll anywhere. But honestly, once these numbers are this big, they're just big numbers. Whether it's 20 million or 30 million, they're big numbers.
Well, that's really helpful and helpful to sort of understand that while we have some data, as is the case with a lot of the work that's happening now, that we're working with patchy data in some places and trying to kind of track this with data that aren't perfect in a lot of ways. So thinking through what some of those challenges and those gaps might be, I think helps us to better understand what the fuller picture might look like and what we might be able to expect moving forward. Do either of you have anything else to add about the most recent data that we haven't covered?
Well, one thing that Jordan touched on, I believe, was that government employment did not, was actually down this last month, and a lot of places, it accelerated in some ways, and that's a big concern because during a recession, you often rely on government employment being like a stabilizing influence, because as I alluded to before, any sector losing employment has cascading effects throughout the economy. So it's very worrisome that both state and local government employment is, it's the rate of job loss is accelerating, and states generally have real limitations on their ability to deficit spend, and there's dramatic losses in tax revenue going to be happening at the state and local level. I don't think that stuff is hit as hard as it's going to. So most states are just sort of operating on the budget they had at the beginning of the year before all this started. And, it's like in past recessions, the federal government has stepped in because it can borrow money and helped out state and local governments. And that's a really important intervention, because it you can complain about the federal government borrowing money, but this is exactly the kind of circumstance where you want the federal government to borrow money so that we don't have these cascading decline in the economy that just builds on itself as industry after industry is hit by unemployment, which means those workers aren't spending money, which, spreads throughout the economy. So, I said the disease path is going to be really important to how we, what happens economically, but so is whether there's help coming for state and local governments fiscally, so they don't become, even as maybe the private sector starts to rebound, government layoffs start dragging everything down again. So I think that's an important thing to keep in mind.
Great point. And I can imagine that in some ways, government capacity to remain responsive to their state's kind of recovery path is going to be influenced by the infrastructure there and the staff who are there and able to execute their jobs and already be trained to kind of shepherd these plans of recovery through. And so I can imagine that retaining government employees is especially important in the kind of context that we're facing now. So that's a really important point for a couple of different reasons, I think.
Yeah, and there are also additional expenses state and local governments are facing because of this on the health side, but also all these things that are having to be done. The University of New Hampshire is a public university. We're having to spend a ton of money putting up plexiglass to keep, people separated, expanding cleaning of facilities. There's all those sorts of expenses, and people are going to also be hurting for a while. So the significant portion of the safety net that falls on state government budgets is going to be strained. And so it's going to be, aside from the danger of cuts just to the impact on the macro economy, the cascading effect I alluded to, there's also just people are going to need help, and government isn't going to be in a position to do it if it's broke. So.
Yeah, I think that's an important point and intersects with, the nonprofit sector's ability to stay afloat if they're not able to fill gaps, if the state government capacity to administer support in the safety net, especially the expanded programs in response to the pandemic, that could be really challenging to make sure the human services are delivered in a way that's efficient and effective.
Yeah, and it's difficult just because also, these indicators are lagging in the sense that we're getting a snapshot of a month prior. And so when you're asking policymakers and governments to be responsive in real time to a constantly changing economic situation and public health situation with the virus, we're kind of looking back to try to move forward. And so that does present some challenges as well.
Yeah, I just add one final thing, which is, I think the next couple of months are just going to be very, very telling, right? We're going to learn a lot about the disease. It's totally possible that things, people will be behaving responsibly, and, we know a lot more in disease transmission, and the treatment of the disease will be much more effective. And so we will kind of turn a corner on the disease. And it's definitely possible the government will take the kinds of interventions to kind of get us back on the right path economically. So those things could happen, and we could be, in decent shape by the late fall, or certainly by the end of the year. We could be in good shape if we make the right decisions and we do things individually and as a society, or we could be really bad shape. And it's to some extent, there's things we can't control with regard to, COVID-19, but there's a whole bunch we as a society can control. If we make the right decisions, we certainly can mitigate the damage and be well on the road to a better situation by the end of the year.
Would it like to have a little bit of optimism? I think we should wrap it up on that note then. Thank you guys so much for taking the time to talk with me about your new work. It's been really nice to follow this and really helpful to have at our hands as we're navigating this. So thanks to you both for joining me. Thanks to everyone else who joined today. For folks who want to read this or more of our Carsey research, you can find our collection of publications at carsey.unh.edu/publications. And as always, we welcome anyone to reach out with comments or questions about this or our other work. Thanks very much, everyone. Take care.
Thanks.